Welcome to The Explainer. Today we're doing something really cool. We're taking an ancient herbal remedy and putting it under a modern scientific microscope to see if it holds the key to improving a very common but often unspoken modern health issue.
So here's the big question, right? Can an herb that's been used for centuries in traditional Ayurvedic medicine actually deliver real, measurable results when you put it through the ringer of a modern clinical trial? Well, that is exactly what this study set out to find.
Okay, so before we get into the herb itself, let's talk about the why. What's the problem this study is even trying to tackle? It's a huge issue, but one that people don't really talk about much.
We're talking about something called male sexual dysfunction, or MSD for short. And you know, this isn't just one single thing, it's an umbrella term for a bunch of different issues. And the study makes it really clear, this goes way beyond just physical health. We're talking about confidence, well-being, the whole picture. It's directly tied to a person's overall quality of life.
And get this is not some rare issue we're talking about. According to the research, the prevalence of MSD is over 50% in men between the ages of 40 and 70. I mean, think about that. That's a staggering number, which is exactly why finding safe, effective options is so important.
Okay, so now that we've set the stage with the problem, let's turn to the potential solution they looked at in this study. And it's a herb with a really long history.
This is ashwagandha. You might have heard it called Indian ginseng. It's a huge deal in Ayurveda, the traditional Indian system of medicine. It's known as an adaptogen, which is just a fancy word for a natural substance that's believed to help your body deal with stress and find balance. And that stress link, it's absolutely crucial. We all know how much chronic stress can mess with our hormones and, well, other functions. So the idea here is pretty simple. If ashwagandha helps with stress, maybe it can help with these related issues too.
And its history is just fascinating. I mean, for centuries, it was known as a rasaiyana, which basically means a rejuvenator or a health tonic. Then you jump forward to 2013, and a small study hints that it might help with sperm count. And that brings us right up to today, where scientists are using the best tools we have to see what it can really do.
So this is the big question, right? How do you take something from traditional medicine and test it in a way that gives you solid, trustworthy answers? Let's dive into how they designed this trial. You're going to see this phrase, a prospective, randomized, double-blind, placebo-controlled study. Now, that sounds like a mouthful, but it's basically the scientific equivalent of the Super Bowl. This is the gold standard for a reason. It means the study was forward-looking, people were assigned to groups totally at random, nobody knew who was getting the real herb, and it was all compared against a sugar pill. This design is all about killing bias.
So here's how that gold standard actually played out. They got 100 healthy guys, aged 30 to 50. They split them into two groups completely at random. And for 8 weeks, one group got the real deal, the other got the fake. And here's the magic part. That double-blind thing? It means the guys in the study didn't know which pill they were taking, and neither did the researchers giving it to them. That totally removes any wishful thinking from the equation.
And this slide shows you just how brilliant that control was. Group 1 got 300 milligrams of ashwagandha root extract twice a day. Group 2? They got a capsule that looked exactly the same, but it was just filled with starch. By doing this, you can be pretty darn sure that any differences you see at the end aren't just because people thought they were getting help. It has to be the herb itself. Okay, so here we go. This is what it's all about. After 8 weeks of this super strict, controlled study, what did the numbers actually say? Because this is where things get really interesting. So the main takeaway was this. The guys taking ashwagandha saw improvements that weren't just a little bit better. They were statistically significant. In plain English, that means the results were so strong, it's almost impossible they happened by pure chance. Okay, let's break down the fertility numbers because, wow, the ashwagandha group saw their semen volume go up by almost 26%. Sperm count, a massive jump of nearly 48%. And sperm morphology, which is basically how healthy and well-shaped the sperm are, improved by almost 19%. I mean, those are not small changes. This table just makes the difference so clear. Just look down the columns, the ashwagandha group versus the placebo. Semen volume goes up for ashwagandha, but actually goes down a tiny bit for the placebo group. Same thing with sperm number. But it's not just the physical stuff. Look at the scores for sexual desire and quality of life. Big improvements for the herb group, while the placebo group actually reported feeling slightly worse. The contrast is just night and day. And this is a really big deal. It's one thing for something to work, but is it safe? Well, over the entire 2 months, not a single person reported any bad side effects. Zero. That's a huge check mark in the plus column, suggesting it was really well tolerated. Okay, so when you put all this data together, what's the bottom line? What's the main thing we should walk away with here?
I don't think I can say it any better than the researchers themselves did in their conclusion. They wrote that after just 8 weeks, ashwagandha improved orgasmic function, sexual desire, and overall sexual satisfaction. So it wasn't just hitting one target, it was improving the whole experience.
Now, any good scientific paper will be honest about its own limitations, and this one is no different. The researchers themselves pointed out that, hey, this was a pretty small study. It was done in a perfect, controlled lab setting, not the messy real world. And when you ask people how they feel, there's always a chance for bias. Plus, we don't know what happens after 8 weeks. This kind of honesty is what makes science so trustworthy.
And that really leaves us with a bigger, more exciting question, doesn't it? This study is such a cool example of taking ancient wisdom and putting it to the test with modern tools, and getting some really promising results. It just makes you wonder, what other traditional remedies are out there, just waiting for their moment in a scientific spotlight?